Bismillah ar-Rahman ar-Rahim. Dear colleagues and PGs, we are discussing steatotic liver disease, and today we shall discuss what is steatotic liver disease. What do we mean by saying the patient has got fatty liver disease or steatotic liver disease? What is its meaning? What is the underlying pathology? And what is the pathophysiological and clinico-pathological correlations of this disease? So as I said, today we shall discuss what is the steatotic liver disease. The steatotic liver disease, it used to be called fatty liver disease till recently, when on the 24th of June, that is the last month, this new terminology has been introduced and adopted across the world by liver societies. So this is the qualitative and quantitative change in hepatic fat content. So this is the increase in the quantity and as well as the quality. The type of the fat content is changed and increased, and this is called fatty liver disease. So this is normal liver. This is the normal fat content. Here, the fatty liver, and see about the fat content. In the normal liver, the concentration of fat is 5 grams of lipids per 100 grams of weight. And out of these lipids, 14% is triglycerides, 64% is phospholipids, 8% is cholesterol, and 14% is free fatty acids. While in fatty liver or steatotic liver, it is more than 50 grams of lipids per 100 grams of weight, around 10 times more. The quantity is increased 10 times at least. And in the normally, the triglycerides used to be less than 15%. Now this is more than 50%. This is the graphical presentation. This is the triglycerides in the normal liver. But you see, this is more than 50%. So what I was saying, the qualitative change, it means the triglycerides concentration or the triglyceride content is increasing from 14% to 50%, and quantitatively the normal quantity is 5 grams of lipids per 100 grams of weight of the liver. Now this is 50 grams of lipids. What is the histopathological spectrum of the steatotic liver disease? This is there are 5 categories depending upon these changes. Like this is the macrovesicular steatosis. Second feature is the steatohepatitis. Third feature is the cytoplasmic ballooning. The fourth feature is that of the medullary bodies. And the fifth feature is bridging fibrosis. In type 1, we see only macrovesicular steatosis. No other features. So this is type 1. In type 2 fatty liver disease, we see 2 features. One is the macrovesicular steatosis, and second is steatohepatitis. We don't see cytoplasmic ballooning, we don't see medullary bodies, and we don't see bridging fibrosis. In the type 3 fatty liver disease, now we see the macrovesicular steatosis, there is steatohepatitis, as well as there is cytoplasmic ballooning. So 3 features are added now. Type 4A has got macrovesicular steatosis, it has steatohepatitis, it has cytoplasmic ballooning, and it has got medullary bodies. And type 4B has all 5 features: macrovesicular steatosis, steatohepatitis, cytoplasmic ballooning, Mallory-Bodies, and bridging fibrosis. Type 3 and type 4 are considered MASH, metabolic dysfunction associated steatohepatitis. It used to be called NASH till now. The muscle activity score, it may be 0. The macrovesicular steatosis is given 3 grades: 0, 1, 2, 3, 4 grades. Steatohepatitis 0, 1, 2, 3, 4 grades. The cytoplasmic ballooning 3 grades: 0, 1, 2, and of course 1 Mallory-Bodies, 1 bridging fibrosis. And depending upon the score, more than 3 with at least 1 point from ballooning injury, this will diagnose histologically that the patient has got MASH or metabolic dysfunction associated steatohepatitis. What is the clinico-pathological correlation? How does these types correlate clinically? So there will be the category type 1, type 2, type 3, type 4 category. And here we shall see what is the clinico-pathological correlation. Type 1, known to be non-progressive, sorts of benign disease. Type 2, probably benign, or it may be considered mild form of MASH or metabolic dysfunction associated steatohepatitis. Cirrhosis may occur in 1 to 3% of patients with steatosis alone, particularly in the presence of metabolic syndrome, that is the MASH. Type 3, the MASH without fibrosis, it may progress to cirrhosis. There are chances then this will progress to cirrhosis. In type 4, that is the MASH with fibrosis, it does progress. It does progress to cirrhosis and liver failure. So cirrhosis develops in 9% to 25% of MASH patients, 1 out of 4. Once developed, 30 to 40% of these die over a 10-year period. So the 10 years period is really a serious one. 8% of these patients, they develop HCC. So this is the clinico-pathological correlation. We saw what is the fatty liver disease, the steatohepatitis liver disease. There's a qualitative and quantitative change in the fat content. And then we saw there are 4 types of the fatty liver disease. And as the type increases, the clinical endpoints, they are going from benign to worse in terms of the fibrosis, cirrhosis, and liver cancer. So I stop here. Thank you very much. In the coming video, we shall discuss the other aspects of the fatty liver disease.